And as you hopefully know by now, this is our monthly CHFS Racial Equity Program. My name is Rashaad Abdur-Rahman. I'm an executive advisor with the Department for Behavioral Health, Developmental, and Intellectual Disabilities. And this will be, today, super excited because we're having our 1 hour discussion with Secretary Friedlander, which is going to be focused on the state of racial equity within our cabinet. So we're gonna just talk some about where we've been, where we are, and where we're going. Please add any questions that you have into the question and answer box. And just as we're going, please go ahead and add those in. And what I might like to do is, as they pop in, maybe we'll just go ahead and detour and answer some of those questions as they roll in. So as soon as something comes up, please feel free to put it in the Q&A box and we're happy to respond. The chat feature is a little bit different today, but you'll see that you can choose to send a note to everyone. So if you can do that, if you can make sure that you share your note with everyone, that'll ensure that everyone who's on the webinar can see your note and can respond as well. So without further ado, I am just really excited, really grateful, Secretary, that you are able to join us today and to participate in the conversation. You don't need much introduction. I think we all know who you are. So we'll get right into it. And again, thank you for making time to be here today.
Thank you, Rashaad.
Sorry, go ahead.
That's all right. No, I think I told you earlier, we're gonna pretend we're at breakfast together, all right?
We got some coffee, we got some eggs going in the background.
That's it, you got it.
Yeah. And I love breakfast. It's actually my favorite meal of the day. So you had me at breakfast. So I usually start these conversations by asking our panelists, what is your why as it relates to equity or health equity, racial equity? And, you and I have had several conversations. You participated in several panels and you've been able to share some in the past what your why is. I am curious though, as a cabinet, we've been really expanding our efforts as it relates to equity. We've been taking deeper dives, having more expanding conversations. And so I'm wondering if your why has been evolving some over the past year as we've been continuing to push forward in this work.
That is an excellent question. In terms of evolution of the why, I stick by my first, iteration of that, which is, having been at the cabinet for many years and then going away and working in Louisville Metro and coming back and realizing the importance of having this very discussion for the entire cabinet. That remains my main why. And I think it's really important for us to have the conversations that in many ways, up till a year and a half ago, we have never had. So to think about where we've come in a year is pretty amazing. And so I think then the other part of the why is this. As we can have these discussions within the cabinet and have the uncomfortable conversations and model that, and not try to model perfection, try to model who we are and where we're coming from. That helps us all, like within our families, within our communities, maybe expand out, maybe expand that circle out a little bit so that we can all feel more comfortable in that and know that, there are no right answers. They're just different ones and they change with different perspectives and it's not necessarily different isn't wrong. Different is just different. Often. So I think the why is, and I'll tell you the other thing, and you and I have talked about this as well. The unexpected piece of this, the unexpected outcome of these conversations has been some of this cross-cabinet, cross-department discussions that have occurred. Well, what's happening in behavioral health? Well, what's happening in public health? What's happening in DEA? All these different discussions that are happening. And it's not just one department, right? So that we're learning about each other's department through these conversations. What's important about art? You've done such a good job. What's the intersection with behavioral health? What's the intersection with poverty? What's what's intersectionality in general. Those pieces, I think, have been something that's come out of this that I didn't expect. I didn't know that's what we were going to get out of this, but I think it's been really one of the fantastic things we've gotten out of these discussions and your leadership.
It's very, very generous of you to say that. And one of the things that I've said repeatedly, and I hope I'm starting to sound like a broken record, is that leadership really matters. And, the commitment that you've made to this work and the fact that we're still talking about it a year plus later, that level of impact can't be understated. And I get really excited, and it's probably the nerd in me, but I get really excited thinking about the way there are these intersecting benefits. You talk about that cross-department, cross-agency collaboration, we're melting silos. And then there are all these ways that even outside of our professional spaces, what kind of conversations are happening in our social circles and perhaps in our faith circles or whatever it might be, that's really sort of expanding beyond what we originally thought some of the scope of this would be. So it's pretty exciting to think about the possibilities. And although, I think we both have a lot of ambition around what we can accomplish, it's important to look back and say, wow, we went from never having these conversations to creating space where we can share ideas, agree, disagree, share different perspectives, and we're stronger because of that.
I think we are. Part of me, you always want to do more, and you always want to be, everything's perfect, and realizing that's an aspirational goal. But yeah, we never had the conversation before. We had our first direct outreach media campaign targeted towards zip codes that were primarily people of color, or where people of color were most represented, right? And we did direct outreach. We had our first campaign for that, to get folks signed up for healthcare coverage. We when we were doing the vaccine rollout, we were very intentional and brought in equity like the second meeting. And that was because when we had the first meeting, we said, hey, we're missing something here. And that realization that everybody had because of the fertile ground of our conversations, I think really made a difference. And so, there are a couple of real just tangible things that have happened. The most important thing of our generation in terms of response to COVID. And we had two very strong equity components to that. And the most important vaccine rollout ever, equity was at the forefront. I think that's really good. I do.
I'll tell you what I appreciate about that piece is that, oftentimes there's a question that emerges, particularly in some of the feedback we get from these programs, is there's a question about, what are some specific examples of how equity is manifesting? And you're just kind of rolling out these, the largest, some of the most significant public health work of our time. We were able to center an equity analysis in that, which is incredible. And I have a lot of thoughts about that too, given had you not said this is an important piece of the work we're going to do as a cabinet, way back when, would we have been prepared or even had some of the infrastructure in place to do that? And perhaps not. So yeah. There's so much value in that.
Yeah, and I do have to give the governor his credit on that, because he's been out front too. But would we have been able to respond? Would he have been ready to respond to some of his challenges? I hope so, but I hope we've responded in more depth because of this type of panel, because of what we've been doing in our departments, because of our learning communities. I hope the depth of our response has been better.
Mm-hmm. So, we've been talking about this trajectory, this sort of timeline of, before sort of what we've been working on, the fact that it is not perfect, and that we have these aspirations for continuing to improve the work that we're doing. But, we're over a year out from the murders of Breonna Taylor and George Floyd. And at that time, last summer, in the heat of a lot of this racial justice movement, there were lots of organizations that were making statements, making proclamations, really saying we are for equity or so on, but haven't sustained actions or certainly did not articulate an action strategy, haven't sustained that work. So, and I think you're speaking to this, right? But it's, this idea that as one of your pillars, this has been important for you to continue prioritizing and making real. And can you talk just a little bit about, in the context, with all of that being in the background, why you've continued to say, this is one of our key pillars, this is important work for us to be doing?
Well, because it is, but I can have a longer answer than that. Again, we've had some of these discussions. We did some work like this in the city, right? When we both worked for Louisville Metro, we had a group of good, strong, solid, committed folks. But if you don't keep it centered, what happens is it dissipates, and you can make all these great statements, right? But if you don't continue to follow up, if you don't put the roots in an organization, right, the equity roots in an organization, they're easy to pull out. You're planting seeds on stone, right? It's just easy to get them blown away. So it takes work, and where I think, and where I'm pleased with where we are. We've got a long way to go, but I'm pleased with where we are. And, it takes all of us together and a continuing commitment to make a difference. And my fear, and again, as I've articulated, is, a lot of organizations kind of get to where we are. I think we may be doing a little better than some. But it's those next steps, right? It's the what's next. What's that implementation look like? What are those? How do we make concrete? What are not just the talk, but the actions that reflect what we're doing? A lot of the work, in DCBS around foster care and the work that Commissioner Miranda Straub is doing, and those are not easy conversations, because so much then gets reflected because of what we see in a broader community. But we need to take that step back and not contribute to inequity. We need to take that step back and how do we make things better? And those are the action steps that I think are sort of the next steps for us. And I think, but you can't get there unless you continue these conversations, unless you continue being intentional about what we're trying to accomplish.
Mm-hmm. Right. And, that speaks to, I think, also the evolution of where we are now versus where we were, a year or so ago. And some of the different efforts that are now really taking shape in different departments and agencies, and some of the work that we're really looking to continue building upon through the community of practice effort. So I want to jump around a little bit, but I did want to really speak to that community of practice effort, because I think that's related very clearly to what you're saying. Like, what is that next? How do we move beyond? How do we keep moving beyond where we are? How do we keep growing? And so, you and I have been talking some, and several members of the CHFS team have been having this conversation through our communities of practice to say, okay, we're preparing to share some updates and to say, here's some of the work that we've been doing, here's where we are, here's some of our next steps. What are some things that you're hoping to see? You talked about implementation. That's really important. We've got to be thinking in a similar way about how we do this work. What are you looking for as departments and agencies begin to report to you on progress?
So First, understand what we've talked about even from the beginning is that this needs to be an organic process, right? This needs to be a process that we all own together. So that's part of what I'm looking for, that we all have ownership together. And that I know different departments are going to go at different paces. Some departments are more like ready to go. Some departments will need encouragement, and want to provide that and want to do it in a way that is supportive, so folks can learn best practices from each other. And what does that look like when we talk about disaggregation of data? What does it look like when we talk about disproportionality and disparate outcomes? And then what are those things that we can put in place, right, that start to address it? What are those, not just words, but actions? And so each department, I think, is working on some of their racial equity action plans, right? And so working together on what does that mean in that specific department, within, let's say, procurement or personnel. I saw a question about, what's the percentage of people of color in the cabinet. I'll tell you that this cabinet leads state government and has for a while, in terms of what it's called our Title VI, meeting our Title VI goals, right? But what I'll say, when we look and we try to look at disproportionality, right, is meeting that Title VI goals in terms of the number of folks that you have employed. What does that look like at each level of employment? Right? What does that look like at a managerial level, at a division level, at an office level? Those are things that we need to look at and say, if we see something off, why? Right? What is it that we're doing that perpetuates some of that? So I've talked to, I think the strongest place, I think the strongest working environment is one that is diverse from many different perspectives, because of, I as a leader only hire somebody that thinks like me, then I'm going to have these giant blind spots, right? Because everybody's going to think the same way. If I'm a good leader, and I hope I'm an okay leader, I need to have people that think differently than me, that have different perspectives, different lived experiences. That's what makes us a rich community. That's what makes any leader or any manager, right? Those broad perspectives help us be better, help make our programs better, and help make how we work with the folks we're trying to serve in our communities. We can do that better. It's that kind of conversation. And we talked about some of that intersectionality and universality, right? That it's being able to do that, right? Because not only we're surrounding ourselves with folks of different backgrounds and different life experiences, helps us understand so much better and takes away those blinders, right? You don't see it because you never experienced it. We see a lot of that. We have to be open, and I think that's what I want to see. And I guess I gave that personnel example of that's just an example of you can look and say, oh, that's okay, but you have to take the deep dives into information. That takes time. Sometimes information is self-reported. We've seen that with vaccination rates, right? A lot of racial data, some of the ethnic data, that's all self-reported. So some of that data is better than others, but we work with what we have and try to improve what we have.
Yeah, there's a few questions rolling in, and two are really related to this idea of having a more diverse staffing. Mm-hmm. And this question of whether how we're working to increase the number of employees who are people of color, and then also a question of whether we're seeing increases in management positions. And I guess I've got some thoughts around that too, but would curious sort of what your initial thoughts are on some of that.
My initial thoughts are, I hope so. I think so. Some of that will take time. When I was at the Commission for Children with Special Healthcare Needs many years ago, no aspersions on the Commission for Children with Special Healthcare Needs. We were going through a hiring process, and I was trying to be hands-off about it, and it came back with a recommendation that this was just educational, right? The selection was somebody that didn't quite have the educational qualifications of somebody else that was passed over. And it's like, well, they'll fit in better. And I said, that's the wrong way to look at it, right? If all you're looking for is somebody that's going to fit in, right, to a culture, and that's all you're looking for, and you prize that above everything else, then you're just going to get the same. We have to challenge ourselves to think about that's not the way to do it. That's the excuse that people give when knowingly or unknowingly you're trying to cut other people out. And so hopefully you'll see some additional management training. You've seen some of that with the trauma-informed, the resilience pillar. We're going to do that, and you're going to see that as we roll forward. There's some things that are already out there from personnel, and we'll want to support that and strengthen that as we can.
Mm-hmm. There's some of the thoughts that I've got around these particular questions as I think about this how piece. So, we don't have to recreate all these wheels. There are phenomenal resources and guides that we're really interested in leveraging so that we've got some good tools in thinking about workforce equity. There's a national initiative called it's called the National Equity Workforce Solutions. And there's this incredible amount of information around ways that government entities and otherwise are working to boost numbers and to increase representation for staff. So there's some great tools out there. And I think it speaks to the level of, we do have to be intentional in thinking about the how. So it's a really great question. And then the other piece, because you mentioned data, whether we're seeing those increases, I think it speaks to the need for us to be thoughtful around how we're capturing our baseline data. And then setting really measurable goals around increases. And that's going to, I would suggest, vary quite a bit from department to department or agency to agency. But, in building out, in developing our action plans, I think we'll have some great opportunities to specify those things as we get to that space.
Absolutely. And we get to learn. I mean, we are going to give ourselves the space to learn from each other. That's why that learning community piece is so very important. There'll be departments that will be ahead, and that other departments can learn from. And there'll be some departments that try some things and it doesn't work out, or there's something fails some way. Great. Let's learn from that. And as long as we're always learning, I think that's the most important thing we do together.
Yeah, I cannot underestimate the value of learning. That's how we fine-tune things. And there's a question here about, wondering if there's a goal date or a time frame. And, just that this goes back to some of my thoughts around those action plans. I think that each department, each area is going to have to determine specific goals, but also timelines around those goals. Which is, I think there's this opportunity to have this really nuanced strategy throughout our cabinet, because we're looking at the reality on the ground for each of our different work areas. I don't know what thoughts you had about that as well, Secretary.
So within Louisville Metro government, one of the things I learned was if you don't ask about it and you don't report about it, then folks don't know that you care about it. So things that we're going to ask from the departments that we're going to start asking next month, right, is for all the departments to report out, what are they doing around equity? What are they doing around their equity goals? What are their plans moving forward? What are the timeframes moving forward? Who's responsible? Just like any good strategic planning effort, we have to have that in place. And I want to know what's going on, right? And I think that's the gentle persuasion. I always feel like in state government, we think, the secretary could just say, lose their temper and say, do it now, right? There's a little boss thing that you can do that with. But that's not how it works, right? It's just not how it works. It is about education, persuasion, and making sure that folks want to do what we're asking them to do. I know people who are here have the heart to want to do this. And I know that, and I've seen that from responses from across the cabinet. So I know that there are always pockets of folks who don't want to. Okay, I get it. But the overwhelming response is that this is something that we need to do. So we need to hold ourselves accountable. I need to hold every department accountable in terms of a report on what it is that we're doing and what we're seeing in progress. And we're, like I said, we've had all these discussions. Now we're going to start getting some reports.
And there are some really good questions here. And so I'm going to jump around a little bit, but I think there's just a way that these questions are connecting to so much of what you shared. You mentioned intersectionality, and we had a great panel earlier this year with Dr. Brandon Kelly Pryor. She talked about intersectionality and, this idea that we are complex human beings and we each represent many different identities that exist in us at the same time. They're not just we're not fragmented people. We are who we are all the time. So whether we're talking about race, whether we're talking about LGBTQ plus status, disability status, whether you're living in rural Kentucky or an urban part of Kentucky, there is this way that all of those identities make up who we are as complex people. And there's this question here that is asking whether the cabinet is looking at issues of poverty and zip code. And part of what we're suggesting is absolutely, because we can't separate these things. If we're talking about poverty, we've got to talk about the way there are racial inequities in poverty and wealth, and we got to talk about all that stuff. So just your response there as well, Secretary, just the importance of intersectionality as an idea for our cabinet, but also as we're addressing the challenges that we face in the work we do and these internal goals and aspirations to have the best workforce possible. Right.
The answer to that question is yes, of course. Again, something that we've talked about, I had the opportunity when I was with the city to do, it's called, I was the Chief Resilience Officer, which was the best title ever. And I got to see some different colleagues from different parts of the world. And, to look at what was the most important piece in another country, right? There are countries where it's clear gender is the #1 issue being faced in that country. Religion, huge issues depending upon where you are. Caste, it just sort of, all of that kind of comes together where the folks who are economically disadvantaged have real disadvantages in terms of access to political power, making their voices heard. That is, you can look at who we are as complex human beings across the globe and look at all sorts of things that have impact there. When you start to come back to the US, right, we still have challenges around gender and gender identity. We have challenges around, poverty and urban and rural. But I'll say this, we also have what a lot of folks refer to as kind of original sin, right? Which is, we started very early to have a mentality around dehumanizing people to where we could think about slavery as being okay, right? We had this mentality around dehumanizing folks that folks who were indigenous to this country were kind of just viewed as, well, kind of throw away a dehumanization that occurred, right? this country, a lot of it does, when you talk about targeted universalism, right? And that's what this term means. When we start to look at those things that are probably our most ingrained challenges, a lot of them do boil down to beginning with racial inequities. That's where we have, that's a lot of the challenge in this country. If we can figure out how to have those difficult conversations and how to have impact there, we'll figure a lot out. We will figure out how to engage communities authentically, no matter where we are, right? Whether it's in Hazard or the Russell neighborhood in Louisville. If we are able to come together and understand that we need to listen to community and value those folks that we are trying to serve and listen to what they're trying to tell us, and we understand how to do that, we will be better people, we'll be a better cabinet, and we will be much more effective in what it is and the goals that we're trying to accomplish here. At least the goals that I think we should be trying to accomplish here. But I think that's important to address, right? You know, that all of these issues are very important, right? And they all relate to, when you look at rural areas in this state, right? As I started out with, you know, what's that access to economy, right? What's that access to political voice? What are those things that keep somebody from accessing that? Sometimes the divide and conquer piece has been very effective when you look at it. So that's why these conversations are important. That's why looking at what we're doing in the cabinet that has disproportionate impact is really important, because if we're able to get there, if we're able to demonstrate that we can redress some of the things that we even in this cabinet from a systemic basis can address, well, I think that means that we'll have a better Commonwealth and we'll have better communities. And that's really the hope.
And that's such a powerful idea that no one's being left out here.
Right.
If we can be committed to a Commonwealth, to a state government, to a cabinet that is embracing the ideas of racial equity, that we are also embracing the ideas of an environment where LGBTQ plus folks are comfortable, where we're addressing the ills of poverty. And that if we can understand, to your point, that the dehumanizing ideas that we use to make things like poverty okay are also making all of these other harms okay. So we're seeking a common thread, and we're working to address common threats. And we're united in that. We're united in all of that work. So this idea of targeted universalism being that, you know, we're all gonna benefit from these efforts. You know, justice isn't pie. We can all have some. You know, we're not gonna run out if we all get humanized. It's not for everybody.
Right. Well, and that's the importance of the humanization conversation and the terrible impacts of dehumanization. That is not, if we're leaving somebody out, we're doing it wrong. Right? If we're leaving somebody out, if we're leaving rural Kentucky out, we're doing it wrong. Right? As we think about how we do these things, we have to remember that these impacts should be broad. It is. I love that. Justice is not pie. It is not pie. And
I love pie.
Yeah, I love pie too. I even make pie. I make good pie. But if we don't do that, then we're doing something wrong. And that's another piece of it. You know, I know some of the times the conversations can get rough. I know sometimes folks are like, you know, adamantly opposed to what we're even talking about here. But we have to still engage in the conversation. It's hard, right? It's not called difficult conversations for nothing, or it's hard, but to be able to listen and to be able to work through conversations, that's what we're trying to develop the tools and develop the ways in which, like this conversation here, can feel accessible to everybody that's listening to it.
A couple of other questions I want to try and get to here, and I appreciate folks asking questions. Please keep them rolling. So there's a question about whether a lot of this will be mandatory, and I think we're speaking to some of that, but also this idea that supervisors are afraid to address the conversations and are often overlooking the real issues with racial equity in conversations and office etiquette. Yeah, it sounds like there's, in this question, it sounds like there's this reality that, we're still very early in this work, still at the beginning of, in many respects, very early, very young in this effort, and that there are still concerns about concerns and fears. Is this for real or not? Whether everyone in the cabinet is feeling change or feeling like things are improving, feeling like things are getting better. Is this authentic, or is it just hot air? And so I'm wondering, just any thoughts you have to that, Secretary?
So thank you for acknowledging that we're still young in this conversation, particularly for some of us, and that be it nervous, right? Frightened when we've been taught that we can't have these conversations, like it's just going to explode and somebody's going to go off. I get it. But I'm hoping that at least for the foreseeable future, that we should all be. I like this phrase for what we're trying to do. I want to be water on a stone, right? Water eventually wins. And good timing, Rashaad. Water eventually wins, and we have to be committed to continuing and moving forward. We also have to be aware that we are going to fail, right? We're there's so much gradation, right, of the depth of the understanding that occurs within conversations like this. We can fail, as long as we learn, and as long as that's continuous learning. That's all anybody can ask, right? That's all anybody can ask. That's okay, and that's engaging. That's engaging in conversations with folks with folks you don't know. That's an important piece of this. But I do like to think of it as water on a stone. And if you're going to be water on a stone, you have to be committed, and you have to be committed over a long term.
Yeah, there's this tension between the very real outcomes of racism and inequities that are impacting people every day, whether it's the citizens that we're committed to serve or our colleagues that sit next to us. There's this real urgency around how do we move this work forward as expeditiously as possible. And then how do we also make sure we're being intentional so that what we build can last, and that, it's sustainable, and that for years to come, these efforts continue. And, there's a thought shared in here just about that I think elevates some of that frustration of, folks who've been here for a long time and have experienced, ignorance, have experienced racism, have experienced difficult working conditions, and don't feel the change. They don't feel those changes where they are. And the difficulty in maintaining faith that folks will be safe and that folks will be okay if they're in a context that doesn't feel safe and doesn't feel okay. And I won't offer a brilliant answer or statement that can answer all that, because I think that is one of those difficult realities in doing this work, is that we're working in spaces that can oftentimes be difficult to get there.
Yeah, it's a tension, and it's a real tension between change should have happened 100 years ago and where we are, right? And the dynamic of how do you get roots go down? And roots don't go down fast. Roots go down, and the stronger the root system, I don't say the slower it goes, because that's not quite right. But the stronger and deeper the roots go, the harder it is to pull the plant out, right? So you want to set roots deep and broad, and that's what we're trying to do. The now, we can't get away from that. We are a reflection, and this cabinet and the folks who work here, this state, this country, we have to acknowledge that it's a reflection of who we are, right? This cabinet is a reflection of who we are, all big we, right? And that injustice exists, right? Racism exists, sexism exists. All of these things exist as a part of who we are as a society. We can't divorce ourselves from that or create some little bubble that doesn't exist. This is the reality that we live in. But even given that this is the reality that we live in, and that we live in within the cabinet, that is no excuse for us to say, well, it's never going to happen. I don't have any faith that it's going to happen, or I believe not, or daggone it, I believe nothing's going to change, and I don't want it to change. We have to continue, all of us here. We have to continue to push forward. But even though I've been here 112 years, I'm not going to be another 112. So the folks listening to this, this is something that we all need to continue to do. And we all need to continue to foster within our environments. It's kind of where I started, which is, these conversations are important not only for the cabinet, but for everywhere we live, all our spaces. And so that's part of what we are learning together. So I have no idea where this question started, but oh yes, I do now. So there's always going to be this tension. There's always going to be this tension of, we need to be so much farther along than we are, and yet we are where we are. And if we don't set down roots, the plant is easily pulled. Does that make sense?
It does make sense. I think it speaks to what the struggle has always been on this continent. It's been this reality that there's this huge struggle for liberation and justice and humanization in the face of dehumanization and in the face of oppression. And thank God that there are folks who said, I'm going to do this work. I'm going to fight this fight. And without knowing for sure what all the victories will look like, or as Dr. Mulder said, what all the successes will look like, or what all the victories will look like. But we're going to do that anyway. And I think it's important that we deeply feel, and we reflect on when folks do say, hey, it still doesn't feel safe. I think we have to hold both those things. We don't have a choice. We've got to hold both those things, because that gets us moving to say, we've got real people who we're looking in the eyes that we want to be there for, and try to create spaces that are safe and affirming and humanizing. And we recognize this is big work. This is big work that we're doing, that may not get done as quickly as we like it to. And it's that gray area that as a social worker, I'm really comfortable with. But I think, is part of the reality.
I think I feel like I've said this on another panel. I don't know where I've said this, but this dehumanization is probably there. We do that so easily, right? We walk by the person under the viaduct who is houseless, right? And think, oh, they've made, you hear this, bad decisions got them there. Oh, no, probably some, but some of it is the way somebody's brain is made up, and reacts reaction in addiction, right? Some of it has to do with the multiple traumas that someone has experienced. We know this, adverse childhood experiences tells us this, right? And so we end up like not recognizing the humanity of somebody that's right in front of us, the beauty that often resides within. Now, there are sociopaths, right? I mean, we deal with reality, but for the most part, Thomas Merton, right? We're all beings of light, right? And if we're able to see that in each other, we're able to see that humanity, that light, that spirit, right? That's what makes us beautiful. That's what makes a beautiful community, right? And that's from within, right? That we have to remember and hold on to that.
Yeah, Thomas Merton, shining, we are all shining like the sun.
Mm-hmm.
Beautiful sentiment.
Fourth and Chestnut, right?
Fourth and Chestnut, right.
Yeah.
If only Thomas could see it now. No, so I want to try to get maybe a few more questions in. Let's see, there's just elevating the need for us to also be thinking about, yes, recruiting a more diverse staff, but also retaining those staff. And I think that absolutely goes to much of what we've been talking about, this tension between the work we need to do now, the work that may be lifetime work, and all those things in between. Also a question about for departments that have adopted racial equity plans, what types of goals are these departments working on? And I can share that these goals are ranging quite a bit. Some examples, however, would be ensuring that staff are using racial equity tools in making decisions or reviewing policies or programs. Looking at staffing or personnel could be a goal. Looking at procurement, I think as the secretary mentioned, looking at things like procurement could be goals. And then there's going to be some really specific department goals as well. And so I would really stay tuned to that. And what we're hoping is that we'll have another panel conversation here where some of those department leaders will be able to share what some of those goals are or have been, so that we can learn a little bit more about what that's looking like in each of our different areas. So.
Since most folks watching this are state employees, right? So the other challenge in recruitment is just a challenge in general, right? We have to be a good employer, and over the years, that good employer, retirement benefits, health benefits, salary compared to other places has eroded, right? Has eroded over time. And we're going to have to work with our General Assembly partners and other folks like that to try to elevate what it is that we do. I hope that our response to COVID, not to put too fine a point on it, shows how important like everything we do in this cabinet is. And as I started earlier, I'm taking an equity lens on it for sure. But our how we get folks vaccinated, how we respond to crisis, making sure that we get services and supports to folks when they need them. This is what we do, and I think we have done it very well. And I hope the broader community can see that.
So there's this idea that, and we're kind of speaking to this, which we're talking about our identity, some certainly as a cabinet, we're talking about how all of this work that we're doing is connected and how we're all connected in this. I'm also wondering if you could speak to this idea that government should be a force for good. Because that kind of is undergirding what we're saying is important work that we want to do. And also it speaks to how we're situated in a government space. And what does that mean to you that government should be a force for good?
At its best. And we know government has not always occupied that space. And we have to be real about that. But at its best, and where I hope we are as a cabinet and as a state government is I always look at government as like, are we moving in? It's like we're a big ship, right? We're a giant ship. It's designed to turn pretty slowly. So I always look at things like, are we headed in the right direction or the wrong direction, right? And I think within the cabinet that we are headed in the right direction of supporting people, of supporting each other, of talking about resilience and equity, right? And economic support and health and wellness. That all seems pretty important to me and trying to push in the right direction to me. And so government should operate in this space, particularly in the economic system that we live in, really balancing public and private good, right? And defining that as what is best, what is uplifting, what is supportive, talking about the intersectionality for everyone in the community. If we are not talking about what is good and supportive for entire communities and everyone in that community, then I don't feel like that we're going in the right direction.
It's fair. It's fair. I'm wondering as we get close to time here, if there is just a closing thought, something that you would just really want to share that captures, not only why this work is important. I think we've spoken to that some, but we're looking forward here. We've got the remainder of 2021, and then we've got a new year that'll be here before we know it. Just maybe how are you looking towards those time horizons, and what are some opportunities you're seeing for us as a cabinet? And just if you could share anything or in that way.
Okay, here's my most optimistic, and I think some reality here too. We're at a time and a point in this cabinet where we have a generational opportunity, right? We have a generational opportunity to move forward with equity, right? In the community, communities across the Commonwealth have spoken often, loudly, and for equity. We've seen that across the country. So we have this opportunity to move forward on that. But not only that, within my years in the cabinet, we have the opportunity to be creative in our programming, to ask what's best, and to try to implement it over this next year, 2 years that I've never seen before. And we're positioned at a time where this cabinet has never been in terms of the understanding of the value of this place and how it impacts communities across the state. I think we have some no pressure, I think we have some very unique opportunities that we've just never had. And we need to take advantage of that. And we need to move on these things together. And you all know what I think. That's kind of articulated in our pillars. These are the things we need to move forward on. And I think we can, even within the context of this community, this state, this country, the world. I think, I know that we can. It'll take all of us working hard. I tell you, this resurgence of COVID, I've asked myself, do I have the emotional bank to keep moving? But we do when we have to. And so we can do this. The governor says it so well. I'll tweak it a little bit, but we can do this and we can do it together. And I think it's just the opportunity that we have before us that I'm really excited about. I'm a little frightened about, but I think we have this as a real chance to make a real difference and a real lasting impact. And I really believe that we can. I really hope that we can.
So, Secretary, thank you so much again for taking the hour, taking the time to respond to questions, to have a conversation with me, to talk about pie, everything in between.
Eggs and bacon. Well, not bacon. Well, turkey bacon.
Well, turkey. I want to, just really ask folks to please complete the feedback form. You'll see a link there that Miriam put into the chat for you to complete feedback. Your feedback is super important. It really helps us determine what we need to be doing and how we need to be doing it and what type of information and programs you all might be interested in. Our 2021 schedule of racial equity and resilience programs continues with racial equity on the first Thursday of the month and with the resilience programs on the third Thursday of the month at 2 p.m. Our next racial equity program is scheduled to be on September 2nd at 2 p.m. Want to ask everyone to get involved. As the secretary says, we can all lead from any chair. So there's opportunities, and if in your department, in your agency, ask who your racial equity lead is. Ask who is putting together your plan and your strategy, and if you just want to be informed or if you want to participate and collaborate on that, all of that is incredibly valuable. There was one last question here in place that I thought was just really worth saying in the last minute and a half here. It's a question about, how do we put in place safeguards to make sure we don't go backwards? What if there's an ideological change in administrations and so on, which certainly in government that happens, right? You have new leadership, you have new ideas coming into place. And I think, Secretary, something that you and I have talked about is our work is to embed this in such a way that it's just how we do business, whether it's in our policy, whether it's in our protocols, whether it's in how we review programs using racial equity tools. If there's enough of us standing on the rug, no one can pull it out. So that piece is really important. Ms. Secretary, did you want to have the final thought on that?
I've talked about the roots, but making sure that this is just the way we do business, right? This is just the way we do things here at the Cabinet for Health and Family Services. And that's the expectation. And setting this on a course that when somebody says, well, we need, maybe has a different viewpoint, but here's how we do it. This is the way that we do it. And setting that course, putting the roots in, making sure the ship is steered in the direction that is towards equity, that's towards resilience. That's what we need to do, and that's what we're trying to do here.
Thanks, everyone. We're at time, so we're going to close it down, but really appreciate your participation. Thank you, Secretary, and we'll see you all in a month. Take care.